Do you have frequent headaches? Do you have frequent body aches? Do you feel extremely tired even after doing nothing for the whole day? Do you feel sleepless even after working for the entire day? If yes, you are at the right place, and this is a video for you. I am Dr. Mehta, a consultant physician, diabetologist, and a critical care specialist, and you are watching Doctor Plus, where I'll be your doctor plus something more, and we'll be talking everything about good health and everything good about health. Vitamin D deficiency is getting more and more common these days, and especially since the work from home culture has started. Also, it is very common for those people who stays indoors and rarely go outside and have direct sunlight exposure problems. So, what is vitamin D? Why is it important for our health? And what are the dietary sources of vitamin D? We'll be talking all about this in detail in this video. Vitamin D, also known as calciferol, is the chemical name of vitamin D. Now, the most active form of vitamin D is vitamin D3, which is known as cholecalciferol, and followed by vitamin D2, which is known as ergocalciferol. Now, these molecules are basically cholesterol derivatives, and cholesterol itself is a very important component of many of these vitamins and hormones in our body. And yes, I'm talking about the same cholesterol that is a major factor for heart attacks. But why is it important to know all these? Because vitamin D is a very important cofactor for many of the biochemical reactions, important biochemical reactions that occurs in our body. The major job of vitamin D3 is to transport calcium. It transports calcium from our bloodstream to various organs and tissues of the body, not only bones. Calcium is an important element of various biochemical reactions that occurs in our liver, kidney, and even heart. And these organs and tissues can allow easy access to calcium only if it is accompanied by vitamin D3. So if vitamin D3 is low, the calcium transport across the tissues and cells becomes problematic, and that creates the combination of these symptoms which presents in itself. So if vitamin D3 is low, that creates a problematic calcium transport, and that is why we have problems in our muscle, in our general health, in form of frequent headaches, body ache, tiredness, and sleeplessness. But let me clarify a very big myth around calcium and vitamin D3. If you have a normal levels of calcium in your blood, you don't need vitamin D3. It's a big no. This is a very prevalent myth in our society, and this is not true. Blood calcium levels rarely drops below a certain level because our blood is very sensitive to calcium levels, and our body tries to maintain calcium levels even in case of severe calcium deficiencies. So it tries to compensate the calcium levels by taking it from the bones, and if that goes into excess, it shifts the calcium from blood towards the bones. But you cannot judge a vitamin deficiency or a calcium deficiency based on the levels of blood. So now let's talk about how you can get adequate levels of D3 if you have a deficiency of vitamin D3. Simple. Stand out in the sun. No, it's not that simple. There are a lot of factors that decides the adequacy of vitamin D3 levels in our blood. But before that, let's talk about the most common and rich dietary sources of vitamin D3. Starting with first, milk and milk products. Second, eggs. Third, fish oils. Fourth, fruits and vegetables like banana, mushrooms, and oranges. And the last, fifth, green leafy vegetables. Now coming back to the sun. Getting exposed to direct sunlight activates cholesterol to form inactive D3. And this inactive D3 goes to the liver and gets converted to active vitamin D3, that is known as cholecalciferol. But then the question is, how long do you need to stay in the sunlight to have an adequate levels of vitamin D3? This is a very frequent question, and the answer is 10 to 15 minutes of direct sunlight exposure in the duration of 9 a.m. to 11 a.m. in the morning, where you have your hands and face exposed to the direct sunlight. They should not be covered with the clothes or any other barriers. Also, it is very important to note that you may still have vitamin D deficiency after doing all these stuffs, because vitamin D deficiency is very common. Also, it is important to note that you may still have vitamin D deficiency even after doing all these stuffs, because vitamin D deficiency is as such very common, and it may not be possible for all people to stand out in the sun for 10 to 15 minutes on regular basis. So what can be done in the case of deficiency even after doing all these things? I would suggest you should consult your doctor first, and you would be prescribing a once a week formulation for vitamin D for at least 8 to 10 weeks, and those supplements will be all that is to be done for replacement of the vitamin D deficiency. Also, a bonus health fact: if you have a higher levels of cholesterol in your body, do get a vitamin D3 level check. It is very frequent to have a vitamin D3 deficiency in case of high blood cholesterol levels, and correction of vitamin D with the vitamin D supplements will mostly cover your cholesterol problems. So after completion of your vitamin D supplements for 2 months, go for a repeat lipid profile, that is a cholesterol test, and that will do the job. So this was all for today. This is Dr. Jai signing off for today from Doctor Plus, where I'll be a doctor plus something more, and we'll be talking everything about good health and everything good about health. Do subscribe to our channel, do like the videos and share the videos to everyone you feel this video might help. Also, do comment your doubts on health and disease. I'll be more than happy to help. See you till the next time, and do take a very good care of yourselves. Bye.